We do have a quorum. First thing is, as you know, we had 2 board members resign or retire, and then the commissioners appointed people to fill out their terms. And Mark was appointed, basically, the term that he's filling out really was only for a year. So, I think I'd like for some discussion, but I think he's done a good job, and I think we have a request to reappoint him.
I agree.
Fantastic.
If you're willing.
Yeah, absolutely.
Of course, it's up to you guys.
Well, I believe that position we deemed it was the mayor's appointment. And I believe Jeff Plaster has that conversation with the mayor, and but we can't, I don't know if he's officially said that Mark would be his appointee. But I thought he agreed to it, that he thought that would be a good pick, but I'm not sure.
Okay, so I think Mark has to abstain, but I entertain a motion. We strongly recommend that the mayor reappoint Mark. Is there a motion?
So move.
Is there a second?
A second.
All in favor?
Aye.
Yeah.
So you all received the minutes. Any corrections, comments? Hearing none, is there a motion to approve?
I'll motion to approve.
Is there a second?
Second.
All in favor?
Aye.
Opposed? Minutes are approved. We'll now move on to the health officer's report.
Thanks. Just to start off with some local trends, COVID rates are declining since a late summer spike that we saw. This is based on wastewater data, but does correlate well with what we were seeing in emergency departments and urgent cares. It was like late August, early September, but fairly low right now. Influenza-like illness is also relatively low, but is on the rise. Typically with influenza during this time of year, you'll see 2 spikes. And so we should expect one soon. So just keep that in mind for your holiday gatherings. Wash your hands, cover your mouth, that kind of stuff. And then for these reports, and I don't want to take up too much of your time, but one of the things I thought would be useful is if we just each month highlighted one key performance indicator from the Indiana Department of Health regarding our Health First money and how important this is to our community in promoting health and well-being. So this month, I was hoping to focus on tobacco and vaping prevention and cessation. So, and I'll make it quick because I know you guys are all familiar with this, but I think it's important to keep it in the forefront of what we're doing and on people's minds. So the percent of adults that smoke in the United States is around 14%. In Indiana, it's higher at 16, just a little over 16%. And in Wayne County, it's much higher, closer to 25%. Smoking in general overall is declining across the country, but e-cigarette use is on the rise, and especially amongst kids. So it's estimated that in Indiana, about 1 in 10 high school students report using e-cigarettes. I think the dangers of smoking are relatively well known by most people, right? It increases your risk of stroke, heart disease, lung disease, cancer of multiple types, and peripheral vascular disease. I think the dangers of e-cigarette use and vaping is less widely known, but it is especially harmful to our children. It's been shown to harm brain development, have a negative impact on learning, memory, attention. It increases the rate of future addiction. So not just to cigarettes and smoking and nicotine, but to other addictive substances in the way that it almost rewires the young person's brain. So it's definitely a danger. Our goal is to decrease the smoking rate by 3% by 2027. We'll be doing this by creating partnerships with other groups in the community, with the big goal being starting a tobacco coalition, which will not be led by us, but we will have a representative. The Wayne County Health Department will send a representative to that. That will be to increase community education. The Wayne County Health Department will participate in that, but also Reed Health, the Boys and Girls Club, Purdue Extension, and other partners. We're hoping to promote the Catch My Breath program, which is a vaping e-cigarette prevention program for kids primarily. In the Purdue Extension Partnership, they appointed a vaping and tobacco program coordinator, hopefully to help manage a community-wide effort on this front.
Questions? It's important, very important topic. Thank you.
We're going to kick over and I'll let Posha Slusher, our new nurse practitioner, board certified, introduce herself and tell you a little bit about herself.
Yeah, good afternoon. My name's Posha Slusher. I'm a family nurse practitioner, board certified. I've been in the medical field 20 plus years. Started out as a CNA and worked my way up the ladder. I've been in Wayne County since 2020, but I've been in Indiana since '99. I was born and raised in Kentucky, so. But I'm excited to join the health department. I went back to get my nurse practitioner so that I could work with the population that frequents the health department. So happy to be here.
Welcome.
Thank you.
Kick it over to you.
You can hold on to these. You're just, it doesn't matter. I'm just asking. You don't have to pull up. I didn't know what you meant. All right. We are going to. I believe you already received a copy of the proposed health department dress code. Should have been in the information that was sent out.
Is it in the packet as well?
I don't think I put it in the packet because I sent it out via email.
Okay, sorry.
Really, this is just to get some consistency and allow the department to provide that professional image when people are visiting or when we're out at a clinic. There has been a dress code in the past, but it was never formal. And I think with just the change in administration, it's a good time to go ahead and bring that back. Really, the only individuals that are going to see a change will be the clinical staff. And that's just to get away from the jeans and t-shirts, slip-on shoes type thing that you would generally not want to see in a clinic situation. So just asking to make sure that you're wearing either scrubs or khaki slacks, nightshirt, logo wear, something like that, that if somebody's coming in with their kiddo or themselves, that they can see that professional image and understand that they are at a clinic in a medical facility. With regards to non-clinical staff, there's really not a change. Basically, they can wear what's appropriate for their position. The environmental staff that are going to go on site, I mean, obviously jeans and boots and whatever else is needed to be in the sludge and everything else that they have to deal with. But just a big focus on when they're in clinics. So.
Was there any input from the staff as you developed this?
I discussed it with Dan. I've talked to a couple staff members just to kind of see how they felt with, wearing scrubs and kind of that expectation. Most of them thought it was normal. It was typical they would expect to, if that was the position they were in. I think some of our newer MAs were typically the ones that we would see wear jeans more often. I would say that after they've been on board for a couple months, that after the first few weeks, they really kind of got into that too, of where they were wearing scrubs more often. So I don't think it's going to be anything that's unexpected. We did discuss giving them until potentially the beginning of February if they feel like they need to get anything additional to wear, give them some time to do so.
And all staff members have been given logo wear.
Yeah.
We purchased logo wear for all staff members.
Yeah.
2 t-shirts, 2 polos, a sweatshirt, and a jacket. Yeah. So they have.
I wish more companies would
Yeah.
do that. Yeah.
Yeah, and they can wear logo wear every day if they want.
Yeah.
So
Yeah.
they would have enough to be able to do so.
Do we need to typo on there, I think I do, because I have to sign it. Did any of the rest of you get a chance to review it?
Yeah, I'm looking at it now.
I have a paper copy over here if anybody
Yeah.
wants.
Yeah, I didn't see it concern me at all. I don't think it's good.
It was pretty standard.
It does not conflict with the campaign policy.
Okay.
The county.
I'll make a motion to approve.
I'll second.
All in favor?
Aye.
Opposed?
Thank you. The next item I have is a procedure regarding taking money and receiving money. Basically, again, we didn't have anything official in writing saying this is how we're gonna handle payments made on either side, the clinic or the front side of taking, or the environmental side of taking payments for permits, et cetera, birth certificates, items like that. So this has just been outlined as this is exactly what you do. This is how long you have to do it. You must provide receipts. If we take a check, what information do we have to have? Just a basic overview of this is how we operate with taking payments every day. Again, there's nothing outlined in it that's extreme. It's literally just a walkthrough of here's your procedure for how you do it, how you document it, and making sure it's documented within our WIN system where we keep our recording, so.
I reviewed it. It seemed like it's good business practice
Right.
in general. Any questions? A motion to approve?
So moved.
A second?
Second.
All in favor?
Aye.
Opposed?
And then just some miscellaneous items. We have had some inquiries recently on travel vaccines. We have the general vaccines, but when it comes to specific travel vaccines, those are not items that we carry. So if you happen to hear any questions or people inquiring about that, that's not something that currently we carry. Yellow fever is one we've had calls about. Some of them, like monkeypox, we don't have an ultra low freezer to be able to store it, and once it's refrigerated, we only have eight weeks to use it. So right now, it's not something that we get enough requests for to keep those on hand. So I just wanted to mention that if you do have any inquiries that we don't have those specific ones. A couple things that we've implemented or we're implementing this week. Inventory logs and processes, just general procedure of each morning the MAs go in, the vaccine rooms, the med rooms. They have a checklist of making sure the supplies are full, everything's ready to go for the day. If they have a patient in there, they're not having to run out and get something because it's not stocked. We're training all of our MAs to be able to cover all duties. This includes registration, blood draws, TB tests. So if right now we have a good staff coverage, but if we have somebody out, we want to make sure that everybody else there is able to handle every aspect of it. Last week, we had at least one day where we had multiple clinics. So we have two mobile clinics and then the office. So we have to typically call in some backup from Brittany to help us. But it's imperative that everybody has the same mindset and ability when it comes to covering those duties. With the mobile clinics, hopefully you'll start seeing the RV out more. We've started taking that to, like when we're at the Goal Way, instead of being inside, they're parked in the parking lot. They're going to start taking it to Hagerstown. They are typically inside of Hagerstown, but they're still going to have the unit out there. It's a rolling billboard. There's not a better way to get our name and information out there than to see the big RV. If you were at the parades, we had the RV in the parade as well as a truck. We had staff willing to participate and help with that. And I wanted to touch on that just because we are seeing more FaceTime, I guess. Looking at like our Facebook numbers in the last 28 days, our views are up almost 27%, our reach is up 35%, and our interactions are up over 147%. So just the small things we're doing with that and trying to get our name back out there in the positive light, I think we're seeing benefits from it. We recently had, we were recently notified of a potential chickenpox case. We just received notification that that was a negative, so no concern there, but just some of those things that we don't typically see now that there's the vaccines for them. But it is something that we try to stay on top of, and we work with the state to make sure that if that does happen, that we would be able to go to that school and do clinics for that, or vaccine clinics. One other thing, I believe it's in your packet, or it was in your email, it's probably not in the packet. I am requesting to switch one of our office spaces and one of our exam rooms. Currently, we have our public health nurse office that's situated closer to our vaccine rooms. And then we have our STI testing room that's kind of off the beaten path a little bit. Oh, it is in there. And it's more back where we store items. It's back in what we call the bullpen. That room that the STI testing is currently in is also a very small space. It's 48 square feet at this point. And then our public health nurse office is about 64 square feet. So I'm requesting that we be able to change the building setup a little bit and swap those two spaces. It allows for a better flow. When someone comes in to be tested, they're still up in the clinic area next to the other rooms. And they're not having to walk back into where we're storing stuff or where we have our lab pickups. Right now, the space, the way it's set up, we have the patient in there, and then whoever's doing the testing, if that patient brings somebody with them, the three of them cannot fit in the same room together. So this will also help accommodate anybody, a spouse or anybody that they might bring with them. If we need to bring a medical assistant in to be with the nurse practitioner, et cetera, it would allow for more space for that. The big kicker for that is we will have to take carpet up in the current office space and put down the luxury vinyl flooring like we have in the rest of it, since we will be doing blood draws, et cetera, in that room. So that's the biggest.
If the board approves it today, then I'll be approaching the commissioners tomorrow for the building modification.
Yeah.
And you have an estimated cost?
It's honestly right around $400.
We're gonna do the work.
Yeah.
The health department's gonna do the work. We're not gonna have maintenance come in and do it or anything like that. We'll take care of the tearing down of the desk. The only thing that we're gonna ask the county to provide is permission for one, and to the IT department to rehook up our technology from one office to another. And that's at their request. They don't want us moving office, and equipment.
Improve functionality.
Yes.
And we've discussed with, I've discussed with Dan and with Bosha on, if you've been in that building, it's just kind of awkward the way everything flows. So I do believe it. And it also puts that STI exam room right next to the restroom, which will be very beneficial for some of those swabs and et cetera.
And it keeps the patient from walking through office space. It keeps them confined to the clinic functions.
So our expense is really just buying the additional flooring.
Material, just the material.
Yeah. Yep, just the floor.
Will there be a cost for paint? Because I noticed that too.
We still have me.
I figured that it was why it wasn't
Mhm.
included. Okay.
Any other questions? Can entertain a motion?
Whose turn?
I think it's mine. So moved.
So moved.
I'll second.
Oh, second. Okay, all in favor?
Aye.
Opposed? Motion carries.
I believe that is all on my update list, unless you have any questions for me.
Director, report.
So we'll start off with our Health First Indiana partnerships. We received our documentation from Centerstone today for the Stride Center. I did not bring that with me today. We'll approach it next meeting. I'll make sure everybody has it in time so they have time to read it and understand it before we ask any questions or stuff. There were some things in there that I seen that I highlighted just in the short
Sure.
amount of time that I had to read over it.
Sure.
So we do have that to look forward to in 2025. I did submit via email 2 contract proposals for Reed Hospital. They want to amend their current contract with us. There's 2 options for those amendments, and one is for another community health worker, and the other one is to increase a part-time person essentially to a full-time person. Has the board had time to review those 2 amendments? So on the screen is the first contract amendment that they.
It's colorful.
Yeah, it's colorful. This would be the 3rd time I've been disconnected.
I think the commissioners do something about
Yeah, you'd think so.
it. Trust me, I've been complaining. Nobody listens.
Everyone see it now, the best I can with the smallest ones. So the first proposal is for an additional $30,000, $693.56. And in that, they'll cover tobacco prevention, cessation, chronic disease prevention, trauma and injury, and maternal, child, and health. So they want to provide a community health worker, a part-time status. Shrink that down just a touch. And that person would be a lactation and prenatal, perinatal education consultant. So they'd be responsible for program planning and development, developing health education programs and initiatives tailored to the core services that we ask them to. This includes selecting appropriate educational materials and creating strategies for effective delivery of health information. Right now they're doing education workshops. They go to food banks, pass out information and SNAP dollars there. They're running a pretty strong program already. We went to an open house they provided this past Friday to see everything that they're doing with the money the health department has contracted with them, and it's pretty extensive for what the staffing they have. They only have 2 community health workers and 1 director, and they're out in the community quite a bit for the staff members that they have. They're also very good at reporting.
So this addition would be in the perinatal area?
Correct. So that's the first one is the perinatal, and that is the $30,000. Essentially $31,000 is what they're asking for, and that will move the part-time person. This person already exists at Reed Hospital as a part-time employee. She's an RN, and it would move her essentially to a full-time position to provide those services.
Oh, I see. Okay, so expand our position into a full-time.
Correct.
Okay.
So that's the first proposal. The second proposal is to add the person mentioned in the first proposal, plus an additional community health worker. And that additional community health worker would help them expand the programming that they already offer for us, which is tobacco prevention, chronic disease, trauma, maternal health. So they do fall classes, Like I said, they do smoking cessation classes. Andrew, there's community health worker, is now certified as a what do they call it, car seat technician. So he's able to teach families on how to install car seats and then examine them for safety and age and expiration. Also allows them to purchase, can't remember what they're called, I think like IRD tags that you put on the car seat. Disconnected again. That gives identifiers for emergency contacts if they're in a car accident with their parents. Obviously, the emergency contact has to be someone else. So these tags are also purchased with this money. So that is the second contract that they have proposed, and that one's for $96,702.52. So, and how far will it be within Wayne County? Yeah, that's where
They're
they're
going outside the hospital.
most of their services are outside the hospital for this community group. Like I said, they go to Gleaners Food Bank. They essentially attend almost every event that we attend to, whether it's Boys and Girls Club event or the Black Expo coming up in February. We just had an event this past Saturday at Girls Inc. And they essentially attend those as well. Where we cover our services that we offer in the health department, they're covering all the KPIs and stuff that they're doing with the Health First Indiana money at their booths. And I'll get into a little bit more of that. And I'm not asking the board to make a decision today on these two proposals, but I wanted to lay them out for you so we could have a decision at the next Board of Health meeting in January, and we could give that decision to Reed Hospital.
Dan, I have a question.
Sure.
So this is the first time going through this, and now we have an entity that we gave a lot of money to, and we're only 6 months into it. So would this set a precedence upon the others within that we have given money to say, hey, you're already in it, you gave us data, you're good at giving us data, so now employer A said, hey, yeah, I want to add, here's 100,000. So is that precisely then a precedent to say, okay, yeah.
I think
so you're gonna
anytime
meet
you
these
modify something, you
KPIs.
set a precedent. I mean, I think anytime you do that, you will. Yeah, will you open a can of worms with it? Absolutely. Is it for a good cause? It is for a good cause too, and not that any other agency that would bring a proposal wouldn't be for a good cause. This is the only entity that has reached out and asked for this request. So, and it will be, and I'll cover the financials here shortly, but it will be not straining, but it will eat up the remainder, if not 60% of the remainder of our Health First Indiana money, depending on which proposal, if any, the board approves. But yeah, it does definitely open that door for other agencies to amend their contract or try to come in midterm and with a new contract. So when we shut down the RFPs last April, I believe.
And I think we also encouraged them with the product.
We did. Like I said, the programming that particular organization is doing, and what we see Friday and the reporting that I get monthly, is really good. I mean, they are performing well. They're reporting well. They're falling within the invoicing. They're falling within the means that they originally said they would. They've not asked for any more or went over. There's 3 of the contracts that we have out there that are really good at reporting and invoicing, and the other 3 not so much. So Reed is one of the ones that is really good with it. So, like I said, this is the board's decision. I'm good with it anyway. I'll make it work with whatever the board chooses. Whether it's first option, second option, or no option, we'll make it work. But they are providing a good suite.
Is that the way they're proposing it? Like they're giving us several options to choose from? Or are they asking for full fund of both
No, originally, they were asking for just the lactation and perinatal position.
Yeah, that expansion, okay.
Yeah, so, and then they come back with what they've seen in the community so far and what they could do with an additional community. They've seen
Yeah.
what they could do with that, so that's why they did the second proposal. And the second proposal covers
Got it,
both those positions.
okay.
So essentially, you're adding approximately $60,000 for the community health worker
Yeah.
on top of the original proposal.
Okay.
So it's either the smaller commitment, which is the first proposal, versus the larger commitment, which includes the first proposal plus an additional.
Yes,
Yes.
yes, okay.
And it would, and I'm new to all of this, but it would seem like to me that the idea is to use all of the Health First Indiana money, if possible, to get the most benefit for our community. And they do seem like they have big ideas and passion for the process.
I wouldn't be afraid of setting a precedent. I think you just decide each request on its merits.
Yeah.
And if funds are available.
Or is there a need to do another request for proposals?
Exactly.
Yeah,
Ron, would there be a need for an RFP if there's a contract amendment for the Health First Indiana funds? For somebody we already have, would we have to send out another request for proposal?
I don't know. I mean, I wouldn't, I don't know the terms of the Health First Indiana finance. I would clear it through your contact.
Correct, so if we, in the past, and other contracts that we entered into, typically, we didn't have to do an RFP for an amendment, but I'm not the legal scholar here, so I'm just going off.
That's what I was getting ready to say.
Yeah.
My experience is usually that, unless you're changing the scope
Right.
significantly and you're amending the existing. Just as a matter of whatever your procedure is regarding an amendment.
So typically in the past, we have not, but like I said, I'm not the legal scholar. I can pose that question to Ron and Chris.
But the second position, does that change the scope? at all,
Doesn't
or
change
not?
the
It's
scope, it
still in-
only,
It's still within the existing
it's within
scope
the
of what the
existing
contract
scope of
was?
services.
Okay.
They're only expanding those particular services,
Okay.
so.
Are you changing the key performance indicators that are the focus of the contract?
No,
I think that's be what, I can't speak for the state, because that would
the
be
state
risky
doesn't.
in any event, but I think that would be one of the first things they'd look at.
So I asked the state, and they said that decision's to be made at a local level. The only thing that they ask and require is the posting of the 30 days. So once we don't even have to put the proposed changes out there, once the board accepts and the commissioners accept, that's when we have to post it for the 30 days. So just something to think about on those two proposals, and you should have them in your emails. If you don't, please let me know and I can get them
I
to you.
guess one other thing, is anybody else that we awarded contracts to providing any of those services in the other contracts that they would
Yes,
possibly be able to, I guess,
they
submit
all,
a counter proposal themselves or whatever they want to expand?
so they all pretty much touch on the same, they overlap in some way. So we have at least 3, if not 4, contractual people doing tobacco prevention and cessation. Almost all of them are doing chronic disease prevention in some form or fashion. Trauma and injury prevention, Reed and Boys and Girls Club and Purdue, and then maternal and child health, three or four of them are all touching a little bit. They're all doing something a little different, so they are overlapping in a sense, or duplicating services, but that's a good thing. I mean,
Right.
if we can saturate the market with the information and education, I'd rather them duplicate. Any questions on those 2 extensions? Proposed extensions? All right. And then as Dr. Bells had mentioned, are working on Tobacco Prevention Coalition, Purdue spearheading it, and Reed is second behind them, helping them spearhead it. And then once all the partners or players are involved, then a meeting will be called. And should be happening the last week of December, first week of January sometime. And the next thing, never mind. I keep forgetting I'm not broadcasting anymore. In your packets, on page 2, this is a success story. So this is something the State Department of Health asked me to do, is anytime we have a success story or something happen in the community with the HFI dollars, that we send them a snapshot, essentially what has happened, so they can put it on the website. And like today, we had our meeting, and they present these stories in these meetings to the whole state of Indiana during these. This wasn't mentioned today, but it was probably be mentioned in the next meeting. So for the public that can't see this, in September and October of this year, Reed Health focused on establishing the community health team with the assistance of the funds from the Wayne County Health Department Health First Indiana initiative. With that money, they attended a few events, one on October 28th. The 2 community health workers and the Jessica Sheeby, she's the Director of Community Health and Engagement, attended the monthly Gleaners mobile food distribution. Typically this distribution is passing out food. The Reed team worked with Gleaners to provide information on food resources, specifically the SNAP dollars, Double Dollars program. The community health workers went car to car serving 467 households with information both in English and Spanish on how those families can access fresh local food at the farmers market and double their SNAP benefits. In this 2-hour window, they served 467 families. Poor Hannah Snoddy, which runs the farmers market for Richmond, on the November 9th food market, the highest amount of SNAP participations was recorded to date. $2,473 in SNAP tokens cashed out by vendors, $2,824 in SNAP tokens distributed to customers. So they would not be able to perform this without the Health First Indiana money. And another thing they're doing, which I think is beneficial, is a lot of these events they're not setting out Reed Health advertisement. They're not putting the tablecloths and the logo gear. So they look like a community partner out there helping the public. Some people view the hospital or Reed Health in a positive note, some don't. So they don't want to offset anybody by putting that out there. So they're able to approach more families that way. Any questions on the success story? So we're on track with all of our requirements for the State Department of Health and the Health First Indiana. I have all my requirements entered into the data trackers, and the budgets, and they all have been approved. We are meeting with the Health First Indiana team tomorrow on site there at the Health Department. I don't remember what time that is. If anybody wants to come, they're more than welcome to come. And this is basically a meeting to discuss what's happened over the year and where we're moving in 25. And not necessarily us, but maybe the state themselves. So they've talked about updating the trackers. There's a lot of duplications in the trackers. So they thought about upgrading those, reporting metrics, just a lot of things. So I'm hoping they discuss that all tomorrow. The meeting is tomorrow at 10 a.m. there at the Health Department if anybody wants to be present. On the darker note, we have the attorney, poor Chris, I'm running him ragged with contracts and everything else, but He is looking into a contract the health department entered to, and I say health department loosely when I say entered into this contract. We bought $60,000 worth of equipment and another essentially $38,000 guaranteed in testing. This is equipment we will not use. These are, Cepheid is the name of the company, and it is for like flu testing and things like that. We don't see sick patients in the health department to be testing for that. So we're trying to get out of the contract, and we're in negotiations now. Essentially, we're going to be out the $60,000, and they want us to pay an additional $8,000 just to send the equipment back, and still be responsible for the other $38,000 in testing. So $105,000. So Chris is working on that with their legal team. There's no doubt we're going to lose some money, but I'm trying not to lose it all. I'm trying to recoup some of it.
How did you get there?
A former contract person entered into this contract. Not a representative of the health department, nor was it approved by the board, nor by the commissioners. So well, that was an option, and it is an option. But we'll let Chris do the legal part of that. But it was kind of discussed with the commissioners back in July, I believe, July or August, and so they're kind of aware of it. I don't think they're quite aware of this. I've sent them all the information, but we're working on it. We're trying to get out of it the best we can. So I've sent over all the budgets to the auditor's office for 25, with the exception of 2. I'm waiting on Indiana State Department of Health outreach. They have to send me carryover forms for 25, and I've not got those for those 2 budgets. And that is health maintenance and health trust, 2 budgets I'm waiting on. At the present time, we are in good standing with the auditor's office. We have no accounts in the negative, and we've brought everything up to their standards, essentially. So with that said, 1159, and it should be in your packet, sorry, page 3, is our health department fund. That is the fund that the county council funds, typically around $500,000, and then the profits we make at the health department covers the rest. So the budget for that is approved for next year, and I believe it's sitting around $817,000, and that's going to cover all salaries for the statutory positions there at the health department. Moving on to the next is Health First Indiana, and we'll cover that into a little bit more depth here in a second. We're going to have a carryover of approximately $220,000. Health maintenance. This is a legacy fund that once the dollars are expended, it will be over. A possible carryover. When I say possible, we're about 2 weeks behind on these numbers, because by the time the software updates and bills get paid and all that good stuff, so they're pretty close. $114,000 there. Health donations. This is also a fund that once it's exhausted will go away. $6,994. Unless people want to keep donating, I put that out there to the media and TV. They can send us money, we'll take it. Then we won't have to close it out. The Harm Reduction Community Fund. This is the fund that is funded by Reed Hospital, and this helps with our harm reduction and SSP program. It'll be $25,000 carried over, and then I believe Reed Hospital is going to give us an additional $10,000 for 2025. So that would bring it up to $35,000. Local Health Trust. Local Health Trust is another legacy fund that will go away once the funds are exhausted, and that has $71,860. The next one is 340B, clinical services. So there's about $233,000, and I know this number's off a little bit here. It's quite a bit, actually. I believe there's closer to $500,000 that's going to carry over. But that fund's not been updated quite a bit, maybe not appropriated is why it's not in this report. With Posha starting, she's been working really hard to get through all the EMR training, electronic medical record software training, which is how we take money, schedule patients, charting, prescribing medication, all that good stuff. So she is now ready to start operating the program at the elementary level as of now. So we should start producing some funds off that here shortly. The COAG grant, this is a grant that we operated for 2 years that went away, and then we had a remaining balance in that, and we get to keep that balance until we exhaust those funds. We're going to carry over approximately $350,000 on that one. FEMA's, the Fetal Infant Mortality Review Team grant. It's reimbursable, so the number's kind of tricky, but I have $129,000 appropriated for that account. And the COVID vaccine reimbursement fund, this is also one of those funds that once money is exhausted will go away. This is from the administration fees for the COVID vaccines over the last 3 to 4 years. We received our last payment for that, I believe, in September. Any questions on those balances? So the projected numbers, this is for Health First Indiana. And just keep in mind when we're looking at these numbers, there's some things that aren't, when we have a balance of $396 or $1,000, there's hidden fees in there. One of them is just unexpected events. The other one is safety pin. This is not until we can apply for that grant again. We have to use some money to help supply that, and that is the counterpart to the FEMA program. Money to account for the 2025 raises that council approved for our 3 MAs. That wasn't budgeted because they weren't approved by the time we had to submit the budget. That's approximately $10,000, not including fringe, or including fringe. As we expand programming within the health department, money for medical supplies. Unanticipated spending that wasn't budgeted for 25 also was credentialing for our providers, for Posha and Dr. Bells, to make sure they're credentialed with all the payers and insurance companies that we typically use. So we're having Athena, which is our EMR, take care of that service, and it can take anywhere from 3 months to 6 months to get both providers credentialed, and this allows for billing insurance companies basically. And that's going to be approximately $12,000 to get that done for both providers. And then there's a maintenance fee each month for that to make sure they're up to date with those payers. Let's see. And then as we increase testing and stuff, then our EMR bills increase because it's based off how many patients we see basically. So, and then for next year, we owe Reed Hospital for these contracts $226,000. Bridges for Life $21,000. Neighborhood Health $127,000. And then once we get through the contractual parts with Centerstone, approximately $150,000 to them, totaling $525,000. Then we have a carryover of $220,000 and $702,000 budgeted for that. So that gives us, with what we are guaranteed to owe next year and what we have carried over, leaves us $396,995. Now mind you, this is contractual line only. This money only comes out of our contractual line. All the other lines for office supplies and things like that, that money's already allocated for those particular things. So this is the only line in 1161 or Health First Indiana that we have wiggle room, in a sense, that we have extra money that we can extend a contract with, start another program with, things like that. So if we extend Reed's contract, if one of those proposals is approved, then that 396 drops by whatever contract's approved. Then we do have the other contracts that we have for Purdue Extension, Boys and Girls Club. Those are funded out of the legacy funds that I talked about and COAG funds. So when you look at the numbers on that previous sheet, you see that we have $350,000 carryover in the COAG, $180,000 of that is already guaranteed to the contracts that we have. And if you want more detailed information on any of this stuff, I'm more than happy to break it down for you in more detail. There's be way too much detail for a meeting on TV, especially. We'll be here all day. Staffing updates, and I did break down the local health trust and the COAG a little bit on the next 2 pages for you. The local health trust, I'm stuck on that one. Staffing updates. We did hire the Deputy Director of Environmental Services, Mark Broker, who was kind enough to sit on the interviews with us and with Beth and I. The decision was made to hire Chad Kircher, and Chad will start on December 30th. We've also posted the public health nurse position that is open. We've not had any applicants, so we put an ad in Western Wayne News and Kicks 96 to try to get it out there over the next week or so to see if we can increase at least one applicant. If not, I think we're going to have to look into something else as to why we're not getting applications. And if I had to guess, I would have to guess the salary. Our salary is pretty low for a nurse, so that's a discussion we'd have to have with the board and council maybe in the future. Program updates, 340B consultant quotes. So I sent those out to you via email. It's not something that we need to discuss today. I just want the board to have at least a month to review those. They're pretty extensive and complicated, so you can do your research on them if you want. And what they are is basically I think we need to hire a consulting service for the 340B program to come in and see where we're lacking or not lacking. They can run an audit on us and tell us where we need improvement or don't need improvement. And these companies also offer continuing support as well. So I think that would be the most efficient way to run the 340B program. And there's a third consultant out there that has not responded to me yet, but all these consultants were referred or recommended by the State Department of Health. So I sent out an email to everyone a month or so ago on moving the meetings to the second Tuesday of the month. I did not get any negative responses on that. So at this time, I would ask the board to move the meeting to the second Tuesday of the month at 12 p.m. here in the Commissioner Council chambers.
Second.
Second.
All in favor?
Aye.
Opposed?
On to the next. I have reached out to dealerships to ask for vehicle quotes for vehicle for the health department that was approved by the vehicle fleet. Once I get all 3 quotes, I'll take them to the commissioners and ask them for the one they want to decide on. They're 2 of them are pretty close, and one is not even close to the other 2. So, I mean, not even close. I'm talking like $8,000 difference for the same car. I don't know how that's possible, but so I'm gonna guess that one's not going to be approved. We did start a billboard campaign on December 12th, and I put pictures of those in your packet. The one is not in the packet quite yet because it wasn't put up until yesterday, so they didn't have a picture. It's on page 17 where it starts. And page 18 is kind of a description of each billboard. We purchased 3 billboards, and they'll run for 30 days. 2 of them are in English and 1 is in Spanish. So these are all located, and you can see the locations on the sheet, but Sheridan Street, Richmond Avenue, and then Northwest 5th Street. questions on the billboards or suggestions for future billboards? I want to throw a shout out too to Haley at the Fairgrounds, marketing director, for the she designed the billboard for us.
How would you monitor the effectiveness of it?
Well, that's what I'm gonna get to the next part. So, last meeting we had with Dr. Bells, she asked us for website numbers, and that's how we're gonna partly judge whether they're effective or not. You know, obviously appointments in the clinic, and then how many times our website gets, because I made it a point to put the website on the billboards. So, and that's on page 22 of your packet there. And this ran from November 1st to November 30th is this data here. So in that month, we had 2,047 views on the health department site. 800 of them come from the home view, so just going to the home page of the health department. 237 some went directly to the forums, and then you can see the rest of them there, kind of where they go to. So this is my baseline as far as the numbers for the website goes, and then I unfortunately have to reach out to the state to get the data each month, because I can run the report, but I can't print the report. For some reason, only the state can print the report. So I have to reach out to them every month to get this data. So they have supplied me with a quick link to do that. So we should have this data each and every month. So that's one way to track the metrics, and the other way is by appointments. We'll be running reports through our EMR to see if our testing and vaccination rates have went up.
We do ask on intake as well, how they,
Oh, did we have that?
yeah, how would they hear about us or what brought them in. Not that everybody's gonna answer it, but it does give them the option.
And I did go through and I revamped the website. I think it's a little bit more user-friendly than what it used to be. So everything's kind of right there in your face as soon as you go to the home page. You should be able to access almost anything you want without having to go to a menu and doing drop-downs and things. So we did add a list of Wayne County resources on there, which is operated by Firefly. So if you click the link, it takes you to a PDF that has resources from food to clothing to housing to financial help to whatever you need, it's on there. Firefly updates that, to my knowledge, every quarter. They have an employee do that, so it's up to date. And I give them all the credit, because that is a hard list to keep up to date, the way it changes frequently. So that is definitely a good service that they offer. And then we also have a list of warming centers on that webpage as well, that they can click a link and get an address and stuff at the warming centers in Wayne County. We're also in the process of switching medical suppliers. And one of the main reason for that is the difficulty I'm having with this contract and what they want from me. So if they're not willing to work with me, I'll work with somebody else. So McKesson, depends on how you want to say it, is the provider that we're going to go with. We filled out the credit application with the help of the auditor's office, received an account number, and we're just waiting for the green light to move all of our purchasing from Henry Schein to McKesson. And I come up with McKesson by asking other health departments who they used. I asked in Neighborhood Health and other places who they used, and that was the #1 answer.
Yeah, they're pretty good.
McKesson is.
Saying, we used to use Henry Schein, we got away from them too. They were not good.
Can't wait. That covered the room already. So get into environmental a little bit. Housing got called out. I got called out to a house on Saturday via fire department, police department. medical emergency, diabetic lived in the house, evidently didn't take care of his diabetes, had ulcers, opened up, exposed bone. Supposedly, I don't know, that's police department told me and fire department that he literally lost his toe inside the house somewhere, where it fell off from the ulcers. I don't know if that's true. That's what they told me. Within that, there was four or five dogs. 2 of them were found deceased, all the way down to skeletal remains. Feces throughout the house. I mean, piled up high. Over 25 firearms, ammunition. The house is incredibly unsafe and unsanitary. So we're working on our end, and City of Richmond Code Enforcement is working on it on their end. So, and that's where a lot of people confuse our agencies, what we can and can't do. If it's going to make you sick, it's our job. If it's going to hurt you physically, it's their job. So on this, we're crossing metrics here. So they have it boarded up. We're waiting on, we put in a FOIA request for body cam footage and stuff because we are unable to enter the house due to the dangers of the house. So we can have photographic evidence for the unfit order. And most likely, it's owner occupied. It's not a rental. It's owner occupied. Most likely, we're going to have to go through the legal process to have the house officially deemed unfit. So just putting that out there to the board. Food, we had an Amish grocery store we had a complaint on that was operating on the west end of the county, almost on the county line, that did not have a permit, was operating without a permit, and was selling potentially hazardous food as far as meat, anything that has to keep refrigerated or maintain temperature. It's considered potentially hazardous. So I went out there with the food inspector, and we had a conversation with the gentleman, and he's bringing his store up into compliance and filing for the permit. It was actually a nice little store. Probably go back out there once he's permitted. On the lead side of things, the question was posed to us. The Housing Authority reached out to us, and they're essentially asking us to lead test our apartment complexes, and it's just not something we were able to do. And I'll explain that in depth here. In your packet on page 25, you'll see when we test a HUD apartment, for one, the health department typically doesn't get involved unless there's an elevated blood level with a child. That's just not something we do. And there are no children that live at these complexes. So we have to do a random sampling, and we have to test so many apartments in order to make that happen. So for this particular thing, Merle Henderson, I think was the apartment complex actually in question, has 104 units and was built in 1969. So if you flip over to the other, page 26, on the last columns between 1960 and 1977. And if you scroll all the way down, actually you have to move over to page 27 to get that far, but you'll see if the apartment complex has 100 to 109 apartments, which Merle Henderson does, we would have to, at minimum, test 25 of those apartments. And that is every room, that's every windowsill, that's, just like we do a single home. A single home would take us 4 hours in the field to do, so this literally would take us weeks and weeks and weeks with what I have as far as the inspector goes. And it's just not something we can accommodate. So if there's any questions or concerns, anybody's more than welcome to contact me. My information's on the website. I have business cards out in the community that have my cell phone on them. I mean, there's a lot of different ways to contact me. Feel free to contact me, and if we're able to help, we'll help. This is unfortunately something that we're not able to help with. Are there any questions on that?
They needed that for some certification. Exactly.
It's a HUD certification, to be a HUD.
Yeah. But on the other hand, if they had a child who lived in one of those apartments, you could do that individual apartment if that was it.
And if that child had an elevated blood level.
Yeah.
This is more of like a compliance check to keep their status. We had Tim here at the last meeting with the septic system. That is still being pursued with our legal team. In January, I will have a procedure for the board to review for tattoo and eyelash extensions, and I'll email that to you for your review prior to the meeting. And I believe that is all I have. Are there any questions for me? Or Beth? Or Posha? Or Brittany?
Dan, is the board aware that we're going back to a standalone contract for legal services for the health department? I mean, basically, we've had a contract, one contract with the firm. Accounting-wise, I think some of you had a line item for legal services. In building your budget for 25, you basically put legal services, as I understand it, in the Health First Indiana side of the budget.
Yes.
Only reason I point this out is it segues into what I think we're seeing in other areas of the county. A lot more non-compliant properties. I'm getting ready to file probably the second action I filed in 21 years, compelling removal of an unsafe building structure. And that's the commissioners acting as the unsafe building authority. At the same time, we've got more BZA compliance issues with failure to abide by commitments, what have you. I think you're going to be seeing the same thing. I think you are seeing the same thing. I think for the last few years, we've averaged probably 1 or 2 enforcement actions a year. I think that's probably going to be on the increase from what we're seeing. To have an owner occupied in that condition is a head scratcher.
It's similar to our last one on Fifth Street. Very similar. That was owner-occupied as well.
So
But
this
the
separation.
firearm piece of it is what's bothersome.
Yeah.
Is what else is going on.
So this separation has already taken place, or it's going to take place?
It'll be a contract, I don't think. I think Chris is working on it. I talked to him.
Okay,
We
so it'll be a
talked
new
about
contract,
A
goes
month.
to us and to the commissioners?
I beg your pardon?
Goes through us and then the
Yes,
commissioners?
commissioners are signatory to all your contractual agreements.
So that'll be something we'll have probably next time.
Yeah, if Chris has it done, I'll bring it to the board, absolutely.
He'll probably be the primary service provider in contract with the law firms, so everybody's available if needed.
So Chris Armour, he was here, not last meeting, but the meeting before. He's part of Ron's firm. He's been working with me and is going to be taking over most of our enforcement type actions and contracts. So just for example, in the last month, I've given him the contract with Henry Sign, which is for the equipment that we're trying to get out of. A septic case and an amendment with Virgins, which didn't require, basically I had to, for the medical assistant, I had to bring that medical assistant up in that contract to meet the other medical assistants for 2025. So that was an amendment, and it was approved that due to the size of the amendment, there was no need to bring to the board or the commissioners. Advised through legal. So, and then I'm going to have him working on this house, obviously, here before long. But it is increasing. Housing is increasing. Failed septics are increasing as the county ages. All these septic systems are going to start to go out. We have one in Williamsburg right now that has failed. The property owner has actually dug up the trenches, so we got standing sewage out there right now. Luckily, it's wintertime, so we don't have a lot of the insect issues that we would have in spring, summer, and fall. But there's nowhere to put a septic system. The lots are too small. I mean, there's absolutely no physical space to put in a secondary system. There is no repairing this system. So what do you do? So we've got the person on an order of pump and haul. They're not going to be compliant with it. They've already said they're not going to be compliant, but in that situation, I need legal's help because the health department at that point is exhausted every means we can, and unfortunately, that person's probably going to lose their home. But there's just nothing we can do unless the town of Williamsburg creates a sewer district and runs, has their own sewer district, and that's going to eventually happen in Middleborough and Whitewater and all these small communities that are in Wayne County. It's a typical septic system takes up about 2,500 square foot. That's just the leach field. It's not including space for the tanks too. So there's not a lot of lots and waiting birds that are even 2,500 square foot at all. So it's definitely a
So
problem.
particularly affects homes on smaller lots.
Absolutely.
Yeah, okay.
So we have no ordinance as far as lot size goes. Planning and zoning, they do have an ordinance for anything that was platted after a certain date, but if it's platted or zoned for a certain date, it's kind of grandfathered in. But their lot size is 1.5 acres, and that's still small in my opinion. Because if you're building a new home, you better plan for the original septic and a septic 30 years down the road. And 1.5 acres is not a whole lot of land once you add a house, a septic system, a driveway, a garage, outbuildings, all that good stuff. So it's going to be a problem in the future, and that was all leading to we increased the legal line quite a bit for next year, and it's no doubt in my mind it's going to get used.
So the only alternative for those homeowners is the pumping oil in those small lots.
So there's a couple options. You can go to what they call a holding tank, which means you put a tank in the ground, you cap both, or cap the one end, you got to let the other stuff come in, and then you put floats and an alarm in there, and it has to be set at 60%, 2/3 full basically. And once that tank gets 2/3 full, that float triggers an alarm, and then it tells the homeowner they have to have a pump. Then they have to have a contract on file with us with a legal IDEM hauler, and that IDEM hauler has to say that they'll respond within 24 hours of an alarm going off. It's a lot of money. A 1,000-gallon tank, 2,000-gallon tank, you're going to be pumping it once every 2 weeks, which is $300 to $500 every time you pump. And then the second option is what they call a direct discharge system. So you have to go through. You're going to have a septic tank, what would be similar to a dosing tank, and then you're going to have a third tank that is either chlorination, UV lighting, however you're going to sanitize that sewage. Oxygen, there's several different ways. And then once it runs through that whole process, it can discharge onto the ground. But with that said, you have to have a contract with us. You have to create your own sewer district, which means you'd have a contract with us. So that gives us the right to come out and inspect whenever we want, test. The homeowner would have to have a contract with the secondary treatment agency, whether it's chlorination, UV. So that's money for them. They have to do quarterly testing, and that testing has to be sent off to IDEM for their numbers. And you're probably looking at, for a 3-bedroom home, about $50,000 to $60,000 for the system itself, and then whatever it costs for your contract for the secondary treatment company. So not affordable for the average homeowner. A septic system does not add value to your house. If you got a $200,000 house and you put a $50,000 system in there, you still got a $200,000 house.
Any other old business? So on to new business, I want to appoint a subcommittee of the board. With hepatitis C, we've got several things kind of up in the air. We're going to be reviewing, the 340B program, and that's going to involve hepatitis C. We've got harm reduction issues that we need to be looking at, and so I've asked Amanda and Dr. Swander to help look into those. And I'll meet with you also, but meet with Dr. Bales and Mr. Burke. But we've got several issues in the air that pertain to hepatitis C, and I think some of them probably will be fairly urgent over the next few months. What direction, then the committee will report back to the board. Any other business? Then I would move for adjournment, and I think everyone noted our next meeting will be the second Tuesday in December. So, is there a motion to adjourn?
I'll make a motion.
Do you have a second?
I'll second.
Okay. All in favor?
All right.
Opposed? Thank you, everyone.